Hopefully that's okay with everybody. And if it isn't, we just ask that you jump off and then you could watch the recording later. So this is, it's been a year since, almost to the day, since we started our issue-based member sections with Maine Public Health Association. So we wanted to use this as an opportunity to bring everyone back together, provide an overview of what the issue-based member sections are for anybody who might be new and joining us for the first time, to provide updates on the work that's happening with the issue-based member sections, and then to talk about our process for moving forward with project development and selection. So thank you all for being here. If you want, we won't do introductions just for the sake of time verbally, but in the chat, if you'd like to share your name, any affiliation you have, which member section or sections you belong to, or you might be interested in joining, and then where you're calling in from today, that would be great. And then everybody can get a sense of who is here. So we'll start, I basically gave the overview already, but we'll have some housekeeping, talk about what the member sections are, the topics we address, logistics around them. We'll hear from the member section co-leads on what's happening with each one, the work that they've been doing, and for some, what their plans are for moving forward. We'll talk about the processes and protocols, and then we'll leave plenty of time for question and answer. And this is meant to be a pretty informal meeting and presentation. So if you have questions, please feel free to enter them in the chat. And again, there's a bunch of us on, but not too many. So if you want to take yourself off mute, that's fine too, to ask any questions. So just the housekeeping, as I mentioned, and for folks who just got on, we are recording the session, so we'll be sending it out afterwards. We do ask that you stay muted unless you want to ask a question, but we'll take them in the chat box too. It's always a little hard to share your screen and see what's happening in the chat. So if I don't get to a question right away, we will at the end. And then I'll send around these slides as well, along with the copy of the processes and protocols again too, in case anybody needs that. And we did, before we get started, we just wanted to let everybody know about Juneteenth if you're not aware of this holiday. So just recently, Maine passed LD 183, which is an act to establish Juneteenth as a paid state holiday into Maine law. So Juneteenth is the day after General Lee surrendered, and 2.5 years after the Emancipation Proclamation, that African Americans in Texas were informed that the Civil War had ended. So it's been celebrated by that community for a really long time. It was recognized by Texas back in 1979 as a holiday, but it's just, been of late that more states have been recognizing it. Most recognize it to some extent, but now Maine has it as a state holiday, which is great. And just yesterday or the day before, President Biden signed it into law at the national level too. So really great that it's being recognized and that this community and population is getting recognized as much as they should be. So we just wanted to touch on that. And if it is a holiday for anyone today, we thank you for being here and participating in the meeting as well. All right, so we will jump in. So for folks who are new, and is just as a reminder, we form these issue-based member sections to really serve as professional units of the association, and to complement activities that promote Maine Public Health Association's mission and goals. So they're meant to provide opportunities for our members to develop scientific and educational programming content, develop policy papers, and then provide social, professional and social networking, career development, and networking opportunities too. So they're both, it's meant to be a bi-directional relationship where you, as members, are able to help us increase our capacity, but also we are able to help you develop professionally, educate community members, lawmakers, etc. So we currently have 5 member sections. And as I said, we'll hear from each one about what they've been working on in a few minutes. We started out with these 5 based on a member survey that we had put out around where our members' interests lie. So these were the top 5 that had the most support at the time. So we have alcohol, tobacco, and other drugs, which does include opioids and marijuana, climate change, obesity, also thinking about healthy eating and active living, the built infrastructure. We have public health infrastructure, and then public health and underserved communities. So we are open to creating more member sections if there's interest in topics that people want to work on. And we will be sending out a survey. I'll link to it at the end of this presentation, and then it's follow-up that does ask if people are interested in working on other topics. So for logistics around the member sections, just as a reminder, folks who are members of the member sections must be current MPHA members. So just please keep an eye on your status and make sure that you stay active throughout your duration of involvement. We ask that people who participate in the member sections have some sort of experience or just general interest in the section topic. So you don't have to be an expert by any means to participate. As we said, it's about professional development for you. So if it's a topic you're interested in, but you just haven't had a lot of time to work on it or be involved, this is an opportunity to learn more about what's happening in the state and what you can do. Each section is led by co-leads that help with facilitation and administration. We didn't put a time limit on the co-leads term, so that's something that I'll be checking in with the co-leads about too, to see, if you're still interested in serving and continuing. Our meetings are virtually, and currently they're at least monthly. We have taken some months off here and there just due to scheduling conflicts and the time of year, but ideally you're meeting at least monthly. And when we talk about the new processes for project development, that might have to become more frequent meetings too. And then pandemic or not, the meetings will likely stay virtually at this point, just so that we can foster the most participation and inclusion and diversity from across the state. But different groups can talk about whether they'd like to meet in person or not as we move forward and get out of the pandemic. So just some more on logistics, decision making. We do a majority +1. And then we do have a voting mechanism outlined in the processes and protocols for choosing a project to work on. We haven't really had to use that yet because there's only been a few ideas tossed out and most people have been on board with those, but there is a voting process if we need one. And then in terms of activities that the groups work on, as I mentioned a little bit earlier, it can be scientific or educational content, guest speakers, annual meeting help, developing fact sheets, developing policy papers or statements, which we'll talk about the process for that, conducting educational outreach with legislators, which many of the groups have worked on, and then just planning and hosting any other professional or social networking events. And these are just suggestions, and there are suggestions in the processes document as well, but of course we're open to other ideas and really want to foster what you all are most interested in working on. So now we get to a fun section to hear what our member sections have been working on. Unfortunately, none of the folks from the alcohol, tobacco, and other drugs were able to make it. There's a lot of well-deserved vacations happening, but I'm happy to provide their update. They worked on a fact sheet that really emphasized substance use as an ongoing problem in Maine, and then emphasized how it's been impacted by COVID with increased use, increased normalization, and provided some generic policy recommendations for legislators. So that fact sheet was recently finalized, and we'll be emailing it to legislators. We have it up on our webpage now, and that's available for anybody to use for their information and own work. And then they just met yesterday and have had discussions deciding to focus on alcohol as a substance, just because it seems to have a little less emphasis and work happening on it in other areas. It seems like it's a gap that this group can fill. And then again, with COVID and just in general, there's been a lot of increasing normalization and access to alcohol. So this group will be working on that. later in the summer and into the fall. They haven't talked about a specific project yet, but that'll be part of the discussion at their next meeting on August 4th. And that's all to say, with the caveat that if something else does come up, the group is open to working on other substances or issues. So that's open, but right now the focus will be on alcohol. And with that, I will turn it over to Sarah and Cordelia to give the climate update.
Great. Thanks, Heather. I'll start us off. Hi, everyone. Sarah Bridges. I'm going to talk about the first project we worked on for the climate section. So back in March, we held a policymaker town hall. We focused on the Maine Climate Action Plan, transportation, and public health. So we had some panelists who gave an overview of the current situation in Maine and what the Maine Climate Council's goals were to reduce emissions, improve transportation infrastructure, and enhance public health. So first, we just kind of gave that overview of the Climate Council's Climate Action Plan and how it connects to public health, again, specifically focusing on transportation. And then we had Sarah Mills-Knapp from the Greater Portland Council of Governments talk about the urban transportation perspective. We had Jack McKay from Transportation for All talk about the rural transportation perspective. Jean Sedaris from Bicycle Coalition of Maine talked about bicycle and pedestrian infrastructure. And then Todd Martin from the National Resources Council of Maine talked about policy solutions. So that's kind of an overview of what we covered in the town hall. And I believe it was recorded, is that right, Heather? So it's available if people are still interested. And I'll toss it over to Cordelia to talk about our current project.
Hi, I'm Cordelia Hill. And after we worked on the town hall, we were kind of talking about what our next project could be. And one of our members is in the leadership of Mid-Coast District Coordinating Council. And so we were talking about their upcoming meetings and how we could possibly kind of integrate climate into their work. So we talked about the shared community health needs assessment and how maybe if we could look to see if there were any connections between that and Maine Climate Council's 4-year action plan to kind of see if there's any synergies or things that are relevant between the two. So right now what we're doing is kind of doing a crosswalk between seeing what the shared community health needs assessment indicators are and the Maine Climate Council's 4-year plan proposed indicators are, and kind of seeing what connections there might be, with the thought that perhaps we could come up with some kind of a tool that could be used among different district coordinating councils or even other public health organizations to kind of talk about, you know, what's relevant between climate change and public health. So for example, you know, one of the Maine Climate Council's 4-year plan goals is to increase or move towards renewable energy by 80%. And so, and also using more electric vehicles. So that could be kind of connected to asthma and reducing incidence of asthma or something like that. So that's kind of what we're working on right now. We're in the process of going through the 2 documents and seeing what connections there might be. But that's kind of our project for this time.
Thank you both. And we'll pause after all the updates just in case anybody has questions specific to this. And to Sarah's question about where the recording was living, we are putting all of the resources that the member sections complete on our website. So each member section has their own page. And then I'll turn it over to Alexis for the obesity update.
Good morning, everybody. My name is Alexis Guy. I use she, her pronouns. I'm a SNAP Ed nutrition educator at Healthy Communities of the Capital Area. And I co-lead the obesity member section with Alan Brown. And we began by developing a definition of obesity, framing it as a chronic disease. We kind of got to know each other through that process. And then we developed a fact sheet designed primarily for legislators to present obesity as a chronic disease within the context of COVID. And present some state level recommendations. And then we held a virtual town hall where several of our members presented, and we talked to legislators about kind of about how we're framing this and the public health approaches and state level recommendations that we want to present. And those are, like Heather said, both available on our page on the website.
Thank you. And then we have Hannah with our Public Health Infrastructure Group.
Good morning, everyone. My name is Hannah Rule, and I use she, her pronouns, and I am currently co-leading the Public Health Infrastructure Group. So we began kind of similar to everyone, just kind of like laying out the land, and I think what we quickly realized is that, you know, just describing the current public health infrastructure was huge, and then also looking at, you know, history, what we wanted to present in that way, and then going forward, what kind of recommendations we wanted to make. So we spent a lot of time definitely just like looking at that whole landscape, trying to lay it out in the clearest way possible, thinking about what our priorities were. And what we landed on was actually creating a story map, which we are in the final throes of getting design-wise, making it look really nice. So our goal with that is to share high-level and in-depth details about the main public health infrastructure. So we think it's going to be a great format for that, and it also includes recommendations to improve the infrastructure in the long term. Our next steps include disseminating the story map and identifying opportunities for connection and training for policymakers. We've discussed a couple of different formats, maybe some training opportunities, some webinar type situations, but we haven't exactly lined it up yet. But those are our next steps for the infrastructure group.
Great, thanks, Hannah. And then our fifth group is the Public Health and Underserved Populations, and Amanda will give that update.
Good morning, I'm Amanda Langley. Liz Charnetsky is my co-lead, and she could not be here. Let me just pull up my notes. So we first started working on fact sheets related to COVID and how COVID was affecting underserved populations. But as vaccines started becoming available, we pivoted because we felt, you know, that was a more relevant and time-sensitive issue. So we pivoted to those efforts and how we could assist. So we've been kind of keeping tabs on the vaccination landscape and especially how it relates to underserved populations. We also, as we were kind of keeping tabs on that and sharing resources with each other, we arranged a webinar on mental health impacts of COVID, specifically on immigrant populations and New Mainers. And that was held on April 9th during National Public Health Week. It was well attended by about 60 community members, which was exciting. For speakers for that, we had Krista Hall and Richia Satel from Gateway Community Services. We had Hibo Omer and Hamda Ahmed from New Mainers Public Health Initiative. We had Samain Ibrahim and Sarah Lewis from Maine Access Immigrant Network, San Pao from Restorative Wellness, and Chan Him from the Unified Asian Community. So they were able to just increase awareness of the immigrant communities in Maine and talk about how they were being affected by COVID, especially on mental health, and, you know, talked a little bit about, you know, how the community could be involved, but it was really educational and well received. So again, we've also been sharing information on efforts to reach the populations that have not had as high vaccine uptake, and also have been getting some updates on vaccine hesitancy, and we've worked to amplify existing efforts and see where gaps may exist. So we learned about mobile clinics and the Health Equity Mobile Clinic, and shared the word on that. And last week we received updates from Matt Wellington of the Public Interest Research Group and Liz Charnetsky, who are both doing some research around vaccine communication, hesitancy, and uptake. So we've been discussing that and sharing that information. And I think our next steps that we just decided this week, you know, continue to talk about those things, but we're also talking about possibly a pre-conference activity for the conference in October around diversity, equity, and inclusion and related to underserved populations. So we're just starting to talk about that, and hopefully we'll have things to share with you in October. Thanks.
Great, thank you everyone for those updates, and also really appreciate you all stepping up and serving as co-leads. I know it's a bit more work than just participating as a general member, so we really appreciate all the work that you guys have been doing. Before we move on to talk about the new processes for project development, does anyone have questions on what the member sections have been working on? You can feel free to unmute yourselves or enter it in the chat. Okay, well, if anything comes up, we'll have, again, time for questions at the end, and you can always email me as well. And I'll put, oops, of course, my dog is starting to bark. I'll put my email in the chat in case anybody doesn't have it. Oops. All right. So we developed a new document for our member sections on processes and protocols for developing new projects. We did this in part to help provide some guidance and direction for the groups moving forward. We realized as we were moving along with the member sections that we hadn't put together a good streamlined process for developing projects, yes, but in terms of getting approval, especially if they were legislative facing or related from our policy committee and board. So we thought it would be helpful to put together a document to provide more guidance and also just to have it written and available to everybody. We also thought putting together the new processes would be helpful for increasing member involvement in our policy work. So it is a crunch timeline to begin, but you'll have the opportunity to present concepts to our policy committee prior to them setting priorities. So there might be an opportunity to impact that as well and just have more involvement there. And then we also have pushed the development project forward so that it's better timing for legislative impact. You never know how quickly or slowly the legislature will work. So hopefully if we can get some of these concepts and projects put together before the session, we won't need to scramble as much and things will be timely and we'll be able to have more of an impact, especially if we're developing policy statements or fact sheets to get those in front of legislators early before they get too busy. So those were the goals and thoughts behind putting it together. We talk in the document about developing projects generally. So this is the same process that you all have been doing this year. You know, group brainstorming about project ideas, presenting them to the group by a championing member if there are multiple ideas, having a vote, and then the winning concept would be presented to our staff and board if necessary for approval. So that's more or less how it's been working so far. And so this process is for anything that is not legislative facing. So as Amanda was talking, their group did the webinar. That was just something the group thought of, presented it to us. We said, great. And then they went ahead with developing it. So this is just generally how it goes. And this doesn't really follow a timeline. So, you know, if ideas pop up, they can happen at any point throughout the year. And then we also have an opportunity to weigh in and create policy statements. So this is something that we had posed for the groups as an option to work on last year. No one did yet, and that's totally fine. But just so you know, the idea behind the policy statements are really to help inform MPHA's position on public health policy and practice issues that can be used by our members to support policy priorities and actions. So it's longer than a fact sheet. It could be several pages long, goes in depth about an issue. It's not tied to any legislation. So it can live on in perpetuity as long as we see it as an issue that we want to highlight and as long as it doesn't need any updating with data or other facts or statements. It's used to describe or endorse a defined course of action. But again, it's not tied to anything, any particular piece of legislation. And then these would be developed by our member sections, or of course, if there is an individual who would like to just work on a policy statement outside of a member section, that's also welcome and encouraged too. So this is an opportunity to have more of a policy influence without tying it to specific legislation. But because it would be a policy related document, we do have this new process for developing them. And this process that you see on the screen is also for anything that you would do that would be legislative facing. So, you know, potentially fact sheets, if you wanted to weigh in on bills, that sort of thing, we would want you to go through this. So it would be the same general brainstorming and voting process that you would use for general products. So we'd have a discussion of what the group wants to work on. If there are several ideas, we would have anyone who's championing an idea present that and then vote. And then we would want a concept of the idea presented at our policy committee meeting that happens in August. So this doesn't have to be a fully fleshed out idea, just a concept so that they can get enough of an idea and react to it. And we'll be putting together some forms too to help, again, streamline the process, make sure everyone's using the same format, and to also help guide you in knowing what you need to present to the policy committee. And that'll be coming in the next couple of weeks. So if the concept is accepted by the policy committee, we would then want the group to submit a more detailed proposal to our board at the November board meeting. And then again, that would get vetted, decided upon, and if it's selected, the group would continue to work on it. And then in January, we would hold or plan to hold a member briefing. And this would be available to anyone, you know, outside of whether you're working on a policy project or not. That defines our MPHA priority policy areas for the year. And so again, this is just an opportunity to find out more about what we're working on. And then if your project is selected and is an issue that the policy committee and board want to work on, we would use January through May to finish finalizing the project and execute or implement it depending upon what it is and what it looks like. And that was a lot in a few minutes, but those are the new processes moving forward. So I think the biggest things to take away from this, and I know the document itself could look a little scary and daunting, but it's just the groups might need to work a little more quickly over the summer, meet more frequently if they want to do something that's policy related. So it's really, I think the highlight is it's a shortened timeline, and really the benefit is that you get to help influence what MPHA works on and have a little bit more say and work more hand in hand with our policy committee than potentially in the past. A little different this time around is that we are only working on carryover legislation, so it wouldn't necessarily be an opportunity to introduce new legislation, but that is something that's a potential moving on down the road. And Becca, I don't know if you want to add anything.
Nope, not right now. Thank you.
Yeah. So that's it in a nutshell. Other things that the document includes are just a longer list of potential projects that groups could work on. And then it also includes a little statement about draft documents and just making sure that we use watermarks and some protocols around sharing them so that we know that they're drafts and not final documents. So that's just sort of a little side note, but something to note in there as well. But does anybody have questions about the new process, comments, feedback, or on what the member sections are working on or what the member sections are in general? And Chris, I know you sent an email, not to put you on the spot, but I am about if, and I don't know if you want to ask it or I can.
Oh, I was just curious about the issue of time sensitivity and how MPHA may need to respond to something urgent or even an emergency and whether we need any protocols around that. So,
The sections?
yeah,
Yeah, I mean, that's a good question. I think that the way that we've been doing it, and certainly we could think about how to make this a clearer process, is either I email people directly or I ask Heather to email all of you directly and ask for some quick turnarounds. It's really hard, though. Some of these issues are very complicated and they are time sensitive. We didn't really talk about, we were trying to have a more planful process, which is what this document is. We did not really talk about emerging issues and how to handle that with a process other than asking for assistance from the member sections with a quick turnaround request. I don't know, Heather, if you have anything else you want to add to that.
Not really, just that, you know, if something does come up, it's not as nice of a process, and there might be involve some scrambling, but if something does come up outside of that timeline, we would definitely want to hear about it, want your help on it, if it's something that we would be addressing.
It came up a few times this session, Chris, with marijuana and having to play defense in some of those bills. And we were able to get some help with testimony and a little bit with legislator outreach. But that's where I do think that this planning document can help quite a bit, because if we can get some more policy statements and some research and information kind of organized, it'll be easier as these bills come up to be able to respond to them. Whereas with some of those issues, I mean, I really didn't know like what the latest, you know, research was, or if I was thinking about it in the wrong way, or if other people had other opinions. And so having this kind of planful approach at the beginning can help a little bit with that, although I'm not going to remotely suggest that those rapid response situations are going to go away, but it may make them a little bit easier to have to navigate.
thanks.
Other questions from folks or comments? Does this seem like a feasible timeline and way to move about, or are you guys like, oh my God, I don't want to do this?
I don't have any concerns looking at it. You know, look more closely and think about how it would apply to our group, but no major concerns from my perspective.
And Heather, you may have said this, but this is a living document in the sense that, I mean, I don't want to be cavalier and say we just created it. I mean, a lot of time and effort went into this, and we looked at, you know, other associations and MPHA, like it was a thoughtful effort, but it's the first time it's being used, and these sections are, you know, just a year out. So if, as you're using them and going through them, please do give active feedback, and we can assess and think about how to make them more workable if there are ways to do that. And I'm sorry if you made that clear and now I'm reiterating it.
No, I hadn't mentioned that and forgot to, so thank you for bringing it up. And on the topic of feedback, I am going to put that survey into the chat. And I did mention the issue-based member sections are only a year old. So if you have any feedback, we put together a pretty brief survey, but if you have more things that you'd like to talk to us about or thoughts that you have on how they're working, we really want to make sure that they're most impactful to you all and that you're getting a benefit out of them.
Remind me again, is the annual conference going to be in person or by Zoom?
It will be virtual this year on October 12th, 13th, and 14th. So we're still working on putting together the agenda. We have a basic outline, but we have our abstract submission process, which we just extended the deadline to July 2nd, and registration is open for that, which I'll put that in the chat too.
It would be nice sometime to meet each other in person.
We agree, Chris. We
Yeah.
just wanted to be mindful that not everybody may be there for a 400-person event in
No,
October.
I think I think that's still a good idea, but it's just this activist group of MPHA members is fun.
I agree wholeheartedly.
Mhm. And we may, depending on what it looks like in the fall, we've talked to the conference planning committee about, maybe encouraging viewing parties or groups to gather in specific areas so that there's some interaction if people feel safe to do so. And Tara, I just saw your comment about having a networking event to see what other interests people have. We haven't done a networking event in over a year, but that is a great idea and something that we can think about moving into the fall when people are, I think, well, Becca and I talked about this the other day. I feel like I have Stockholm syndrome, like it's safe, but just weird getting back out there. So I think it's start dipping our toes into things and getting some face-to-face interaction.
Yeah, we had a holiday party that some of you were at, this is several years ago now, but it was just a really nice way for people to gather socially, like no agenda, no anything, just, come and meet people. And so I agree. I think that having something like that again would be really nice. So we'll definitely keep that on our planning radar. Yes, yep, definitely.
I would just like to add, I was just looking through like, who are all these people I don't know? And I remember going to a women's leadership something or other years ago in Portland. It was 500 women in the Portland area. I think I knew 3 people. And so I just wanted to say, I love that I don't know a lot of you, because that means there's a lot of people doing this great work. And I would love to see some more connections between the topics as well, how substance use can connect to obesity and adverse childhood experiences, like just all those things, and would love for more of connections of how we're doing, how our work all connects. With substance use, we're very much focused on the stigma around that and people getting help. And so sometimes adding it to other topics makes it more palatable to people in the community. So I look forward to getting to know more of you better and how we overlap.
Thanks, Leanne. That's a great point. And something that has been coming up in coalitions is how do you make your topic of interest relevant to someone who might have a different focus, but it's all, we know public health is all related and connected. Becca and I were just chatting back and forth with the conference. Of course, it's not in-person networking, but there are different features built into the conference platform where you can chat with each other, put up messages. So we'll make a more concerted effort to really encourage people to chat about what they're interested in, whether or not it relates to the conference topic, so that we can get some more written dialogue happening between people and making connections. Other questions or thoughts from folks?
Heather, I just wanted to quickly shout you out just for all of your work in doing these, because you come to the meetings, you come to the co-lead meetings and organize all of these for all of the groups, and it's a lot, but you are just such a great facilitator and leader in moving these things forward. So I just wanted to thank you, because it wouldn't happen without your centralized effort.
Thank you. I really appreciate that, and want to say same to all of you, with the help from the co-leads and people stepping up and taking on more volunteer responsibilities. It's great to see how many people have been involved and continue to be involved. And I know for many of you, this is outside of your day job, and it might be a topic that's not even related to what you work on day to day. So really appreciate all of your work and effort, especially because we do have limited capacity. So great to see everybody stepping up and championing public health. But thank you. Anything else? So we will, I'll follow up and send an email out to everybody, not just registrants, with a recording of today's webinar or presentation, another copy of the processes and protocols, and actually I'll make a note to put that on the website too, so people can access it, and the survey as well. So please take the survey, help us with some feedback, and if you have anything else that you want to ask that's not included in the survey or comments on, would love to hear those, and I'm always happy to set up a meeting if people want to talk more. But really thank you all for coming this morning. Becca just put a plug in the chat for the broadband expansion meeting, which is happening next Friday, the 25th at 9. So she sent out an advocacy update this morning that has registration info. And if you are going, just note there's 2 places to register. One is for the actual Zoom link, and then other is more of an attendance list. So just to make sure, I don't think they'll forbid your attendance if you don't remember to do both, but do note there are 2 registration spots. And please feel free to share that with your networks too. So we'll follow up after today. Really, I want to thank everybody for your participation and for coming this morning. We really appreciate it. Please know that we're here if you have any questions or ideas, and have a great Friday, everybody.
Thank you.
Thank you. Bye.
Bye.
Thanks, everyone.